Hi, I'm Bob Schrupp, physical therapist.
Oh, Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
And I'll pay, of course, Bob.
We get a lot of requests, Brad, for they want a video on bicep tendonitis. People are feeling pain in their bicep tendon, and that's usually when you're going to feel it is when you're doing curls.
Sure.
Or what we call resisted flexion. So if you take your hand, let's say it's my right arm,
Right.
and I offer resistance here, and I push, and I don't let my arm to go up,
Right.
that's where you might feel it. More often it's going to be doing like a curl.
Sure.
You might also feel it going like this, because it does serve a little bit of that function too.
Exactly.
So we're going to show you where the bicep tendon is, and also how to go ahead and do the top treatment for it, which is usually a type of massage we do. Cross-fiber friction massage.
Sure.
So, all right, the first thing, Brad, I was going to show, let's show the groove.
You were, but now you're not going to?
I was, and now I'm going to go
Oh,
ahead.
okay, we are going to. Good. I like this. I like the Packer ball.
Yeah, I like it too because it's like an alien coming out of the body.
Yeah, you're just jealous, Bob.
Yeah.
All right, let's get to the subject.
Are we about right there, Nancy? Okay. So the tendon, and this, again, bicep means two, so you got two tendons that are going to attach, but the one we're really concerned about is the long head. Brad, do you want to show?
Sure, you can see this groove in the top part of the humerus here, yep, right there, that tendon, that's what that groove is for, the tendon slides right through there, and it connects, where does it connect, Bob?
Right up here in the supraglenoid fossa.
Yep, right there. So it
Top part of
wraps all the way around there, and that's just tendon. Then down in this area, that's where you get that muscle belly, where the guys always like to get that pumped
Now,
up.
if you actually tear that tendon, what you're going to see, Brad, and you've seen it, I'm sure, on people, right?
Yep.
Where the bicep actually gathers as a ball, and it's way at the end here, and there's nothing you can do about that. They usually don't even surgically repair those.
Oh, really? Yeah.
Usually they just let them go. You still got bicep function, not as strong, obviously, but they just don't do anything about it. As far as this groove is concerned, don't get too hung up on that. What you're going to try to do is find the painful spot and go ahead and we're going to start some rubbing. So let's go ahead.
So are you saying that groove is, over that groove is where you're going to do that massage?
Over the groove or a little bit distal to it or a little further down the arm.
Right.
Find the tender spot.
Okay.
Now the position you want to be in, and you can do this with, you can do it through the shirt, or you can do it, it'd be better probably to do it on the skin.
Yeah.
But you're going to take your arm, you're going to go ahead and relax back, you're going to put it on a pillow, you're going to turn your palm up and out a little bit like this, and now you're going to go ahead and try to find the spot. And you're going to put your fingers, hi Nancy, you're going to put your fingers like this, maybe one over another, or three together, or two together, something where you can apply a lot of pressure. Does that make sense, Fred?
Yeah, I thought you were giving him the...
Yeah.
Just joking, we got humor
Oh,
here.
we love you guys. We won't give you the... Yeah. Okay, so palm up. You're going to go ahead and find the tender spot.
Right.
Okay? I found the groove right there. I know where the groove is, so
Right.
I found the groove. And you're going to rub across the tendon. Now, you're not just moving skin here, Brad, are you?
Right.
You can, even if you don't get all the way up here, Brad, you can show it.
My massive deltoids don't allow me to pull my shirt
No
up.
massive deltoid.
You destroyed my bull.
Okay, you're not just moving skin, you're getting deep down in there and rubbing the tendon. Because what happens after, when that tendon has become irritated, there's scar tissue that's laid down, and we're trying to get that scar tissue to break up. This also brings more blood flow to the area, so it helps it heal.
Right.
But you want it to heal strong. Because normally what happens is that, this is why this becomes a nagging injury, is that it gets tore, you get some scar tissue laid down, and the next time you use it, that scar tissue breaks open again, and the healing process starts all over again.
Right.
So what you want it to do is have it heal real strong, so that next time you use it, you try to use it, it doesn't break open, it stays strong, and
So let's make this clear. Say one weekend I had a big project in my garage. I was going to hang sheetrock, and I normally don't do that, so I'm really lifting hard, and I irritate that tendon. It's really sore.
I don't know that would be, it would probably be maybe a couple weekends. It tends to be more of a progressive thing,
Well,
an overuse injury.
Whatever, you get it so it's real sore.
Right.
Are you going to get after it right when it's real tender, or what kind of length of time?
I would
do you
start
like?
by icing. This is the sign that you want to look for, Brad. You go ahead and start some rubbing on it. Find the area. You're going to rub one finger over the other, two fingers together. You're going to rub real hard. If after a minute the pain is getting worse.
Mhm.
It's not getting better, it's not starting to numb out, then it's too sore, it's too acute, you need to just put some ice on it.
And wait a day?
I'd wait a day and try it again in a day.
Sure.
Yeah. Then, you know, if you get the great sign, which what we would like to see, is that you're rubbing it, and then after a minute, it actually starts to feel numb, or it's actually even feeling better.
Right.
Beautiful. Now you can go up to 5 minutes. I don't know if you can tolerate that long. How many today, Brad?
I know it's hot.
If you can go up to 5 minutes, you can even go longer, Brad. They talk about doing it for 20 minutes.
Right, serious?
Yeah, in Syriac.
Mhm.
So don't feel like you're going to overdo it. Just don't break the skin down. I've seen that where you actually get a sore on the skin.
Right, yeah, this is pretty aggressive, especially if you've got big nails.
So again, pillow, palm up, find the groove or find the sore spot, rub, you know, maybe you have to go up and down a little bit till you find the spot, rubbing really hard, going to do a good 5 minutes,
Going across
the fibers, yep, breaking it up, getting some blood flow to it. If after a minute it's getting worse, you're backing off, you put ice on it. If after a minute it's getting better or numb, beautiful, keep going for 5 minutes. You can do this every day for you know, a couple of weeks, and this generally responds very, very well to this treatment. This is one of these treatments that I've had this, and it was a nagging injury, kept going on. I did this. It was I did a couple of treatments, Brad, and it was fine.
Yeah.
So
I got to tell you, just from personal, just recently, I got tendonitis in my Achilles tendon, and I've been doing it, and I'm getting in there.
Yeah.
I had a video on that too.
Yeah.
But just like you said, after about a minute or two, I started feeling good, and I kept working it, kind of hurt so good. My fingers got so sore, but it certainly improved my symptoms.
It'll do the job.
Mhm.
That's one of our popular videos you have to look for.
Yeah.
So, all right, Brad, we're not just pretty,
We're pretty ugly. I mean, we're pretty old.
we're pretty old. So if you're old too like us, you can always subscribe to us because we're going to provide you videos on how to stay healthy and fit well into your 40s, 50s, and over.
We've got people in their 90s.
Yeah?
Looking at this.
Really?
Yeah, yeah. Be careful
To
with
the
that.
moon, Alice.
Bye, Bob.